Yeah, I'm Gopama Obamano. I'm the medical director in Chevron Nigeria Limited. And I've been asked to just see what's happening here. And we've had a little tour around this place, and we're quite impressed with what we've seen. The burden of sickle cell disease is massive in this country. It's one of the main public health issues we have. And to put it into perspective, when you look at the total number of people in the country, over 200 million, and then you have a good percentage of this population having sickle cell disease. So in terms of numbers, we are high up there. So that brings it down to how many people can be productive in this country with this kind of challenge. And then for those that have this challenge, what kind of quality of life that they live. Now in Chevron Nigeria, we look, especially with our partnership with Nnpc, we look for ways to try and improve the communities we work in. We try and empower them. We try to strengthen the healthcare systems. And being part of this project is one way to kill all these birds with just one stone. That's really got us interested in this, because that way we know that when we change the lives of these people, we've changed the lives of the communities, and we help in improving the economy of the country, have more people that are productive, and then people live longer, and it goes on and on like that. So with people with sickle cell disease, the impact is manifold. For them as individuals, they have challenges in their lives, daily challenges, and then they have limitations, what they can do, where they can go to, and life expectancy, how long they can live because of the complications. But beyond that, you have the impact on their immediate families when they go for treatment, when they are cared for in hospitals and all of that. Somebody somewhere has to stop work to look after them. And then the other impact on the economy of that family, how much they spend. And in a broader sense, the impact on the community, how much can they contribute to the society. So when you look at all of this, when you save the life of one patient, it multiplies. But beyond that, you are giving them a quality of life that will become comparable to any other part of the world. And you are doing it in this country, which means you are taking away the burden of saving money to go elsewhere, to travel elsewhere, being so far away from your loved ones. They don't know what's happening, they don't know how you are faring and all of that. And then you are also adding the cost of all of this, where they are going to stay, the emotional impact. So in a totality, it's a very big development for the individual that has sickle cell disorder. And again, in a broader sense, it's a very big impact on the society and where we want to be in terms of partnering to develop where we work and what we do. I must say for the joint venture with us, Nnpc and Chevron Nigeria Limited, we are quite impressed with the progress that has been made so far on this initiative. The impact is massive, like we've been talking. And for us, it's a big hope. It's a ray of light, especially when you consider where this is happening in this country. So we can only say that so far we are quite impressed with the stewardship, the accountability that has been shown, and we are encouraged to say that we expect that this will be sustained. And when this is sustained, we can only go to greater things. The program or the initiative doesn't stop with the patient. There's a lot that can be derived from the value chain. There are people that will be trained in this lab. It's about the first in West Africa. There are lots of benefits when you look at it long term. So we expect to still be in partnership with them for a long time. And with the PPP, we expect that they will leverage the strengths of the private sector to complement the strengths of the public sector, and that partnership, I think, will sustain the hope for patients living in this country with sickle cell disease. And hopefully with the transplant, they will also move away from that disorder.